My name is Sharon Walmsley, and I'm a professor of medicine at the University of Toronto. I'm a member of the infectious disease department of the University Health Network. I'm the director of clinical research in HIV at the Immunodeficiency Clinic at the Toronto Hospital, and I'm a senior scientist with the Toronto General Research Institute. So I did medical school, undergraduate at the University of Western Ontario in London, and then I moved to Toronto for my internal medicine fellowship, and I've been in Toronto since, so I've completed training in internal medicine, infectious disease, microbiology, and then I went on and did a master's degree in clinical epidemiology. Well, HIV was a little bit of an accident for me, and my story is sort of fun. Is the very first night I was an intern in Toronto, having moved from London, Ontario. One of the first patients that I saw in the emergency room was a young gay man who had come with his partner and had overwhelming pneumonia. And when we had consulted the various services at the time, everybody was saying, "Oh, I wonder if this is a case of HIV and AIDS." And I went home in tears that night because I hadn't heard of this disease. It had just barely hit the medical literature. And having had an undergraduate degree in microbiology, this was kind of intriguing to me that, here's some of these diseases that we described in the test tube but never have heard about in patients. And my particular mentor at the time sort of said, well, why don't you run with this? And so as a very young intern, I started to read around this, gave lectures around around various centers in Toronto, and really sort of took on an interest in HIV. And my original plans was to do bench research, but as I got involved in patients and patient care, my interest really changed to the clinical aspects of research. So as I alluded to, our interest is in clinical research related to HIV. And so what I like to do is take questions that arise out of the day-to-day management of patients in our clinic and try to adapt those to research questions. And so a lot of the research that we have done has changed with the epidemic. So in the early days of our research, a lot of it was focused around some of the opportunistic infections that we saw in HIV, how to best manage PCP pneumonia, how to manage the CMV retinitis that patients would get, how to manage some of the diarrheal syndromes that patients got. And then obviously with the advent of HAART and all those things disappeared, our research focus changed. And then we did a lot of work with many of the antiretroviral drugs that are available, but our particular interests were really in terms of many of the adverse events that were associated with those drugs. And so we did research related to lipodystrophy, we did research related to lipids and lipid problems, and many of the complications of therapy. More recently, our research has focused on co-infections, and in particularly, we've been looking at the interrelationship between herpes virus infection and HIV infection. And we know that those two viruses negatively impact upon one another. And so our research is, if you manipulate one of the viruses, can you change the course of the disease in the other virus? And so that's a lot of work I've been doing together with my PhD student, Dr. Daryl Tan, and has been the focus of our research in the recent years. We've also been participating in studies of hepatitis C, and of course that's a new area that is emerging as more and more agents are available for the management of hepatitis C. And of course there's a lot more questions that has to be asked in the face of HIV, particularly with the drug interactions and the additive toxicities that we may see in that field. Well, the OHTN has played a very pivotal role in my career in that it's been a very important source of funding. So it's been an important source of funding for many of the projects that we have done over the years, not only personal funding to my own projects, but also to many of my students and co-investigators that I've worked with over the years. And then, of course, personally, I have been successful in obtaining an OHTN Career Scientist Award, which has allowed me to protect some of my time away from clinical practice to be able to focus on my research and in developing our research team. Well, as I alluded to before, our research really asks those clinically based questions. So the questions that we do for research are things that come up every day as a part of our interactions with patients. And somebody may say, well, what about this? And we'll say, hey, we really don't have a good answer for that. And then that's what will lead to the development of a trial or a study to try and investigate that problem. So we like to think that our research will definitely have an immediate impact on what happens in the current epidemic of HIV and is what is happening to patients at this particular point in time. So doing HIV research is fun, but it's tough. And so the key to it is really to have a passion about what you do. And doing HIV, it's easy to have passion. There's lots of interesting research questions that come up all the time. There's a lot of interest in research. Patients are often willing to participate in research, and it's good to get good collaborations. But research is hard, and the research dollar is tough, and you'll have to write a lot of grants and get a lot of rejections, so you have to have a thick skin in order to be able to deal with all of that. I think the key thing for a young researcher is to have a good mentor. And you need to have someone that will be very supportive of you, that'll help be your champion and help support you in some of the ideas that you want, to help you develop your ideas into great research projects and get good funding and get good publications to allow you to get your own career off and running. And that mentor has to not only support you, but also has to give you independence so that you do get a lot of recognition for the work that you do yourself. My hopes for the future is to live a good, long, healthy life, to climb Kilimanjaro, and to have a great career that I can remember for the rest of my life.